When most people think about healthcare in this country, they think about cancer or heart attack, something dramatic, something high technology. The problem is that most healthcare isn't that sort of thing. Most healthcare is chronic diseases, problems like diabetes, hypertension, heart disease, that people have to manage over decades. In the Medicare population, chronic disease problems account for 90 to 95% of all spending. Among working populations, the percentage approaches 70%. And our healthcare system is not well designed to manage chronic disease. So how do you fix this problem? In my view, there are two fundamental challenges. One is you have to create economic incentives. The healthcare system fixes itself so that it gets interested in and more focused on maintaining wellness, preventing chronic disease, and managing chronic disease appropriately when it actually happens. Secondly, we have to develop the informatics tools. The physician's office needs to not just look at each patient as they come in, they need to be looking at their whole population of patients, particularly those with chronic disease, and spotting problems before they happen. As the information technology has evolved to the internet, to the cloud, to mobile devices, to wireless devices, many other industries have transformed the way they do business. Healthcare has been slow to do these things, but it's all starting to happen now. So we have this fascinating convergence of events where the technology is starting to be available, the economic incentives are starting to go in the right direction, and as a result of that, I'm seeing an explosion in entrepreneurial activity. Here in Atlanta, we have one of the nation's greatest concentrations of health IT companies anyway. But there's scads of new entrepreneurs here in town, some of whom luckily come from Georgia Tech or are based at Georgia Tech, who are doing new companies. They're developing web-based tools to help physicians manage their patients with chronic diseases better. There's a company I'm aware of that's got an interesting approach to using machine learning to predict which diabetic patients are likely not to do well, so the physicians can devote more time and attention to them. So there's an explosion in entrepreneurial activity. There's also a great deal of research going on here at Georgia Tech that's relevant to this space. We have researchers very interested in the home. We were very early to be interested in the home. We created the Aware Home in 1998. Today we have researchers interested in technology in the home that can even understand people's behavior better, so that maybe we can understand when people with chronic disease are beginning to get out of control before their physiologic measurements. We have many researchers that are interested in mobile and wireless technologies and developing apps that can change people's behavior. This is a new field. There's a lot that remains to be done, but we've already had interesting research done here showing how something as simple as SMS text messaging can be used to help asthmatic children manage their condition better, or diabetics manage their condition better. And industry, even large companies, are getting very interested in this space. Microsoft is a leader with their Health Vault product, which is a personal health record, a place where patients can bring all their health data together, much as we tend to bring all our financial data together. So it's an exciting time in healthcare, it's an exciting time in health IT. I think it's an exciting time for Georgia Tech to be involved in this space.